Hey, it's Roberto Miki again, and we've got another great question of the week. It's number 12 in our series of questions for medical students, residents, and fellows who are interested in studying for the boards or in training exams. So here's our question. A patient presents with the fracture depicted in the x-ray below. Which nerve must be examined closely? A, the axillary nerve, B, the median nerve, C, the ulnar nerve, D, the radial nerve, or E, the musculocutaneous nerve? Well, here's your chance to pause the video so that you can answer the question yourself. So the x-ray depicts a spiral distal third humeral shaft fracture which is displaced. This fracture is classically called a Holstein-Lewis fracture. The fracture is often associated with radial nerve injuries. Injuries can be as simple as a neuropraxia or as severe as a complete laceration. Radial nerve function must be examined well and documented. The radial nerve motor exam for a palsy at this level will demonstrate an absence of wrist extension, finger extension, thumb extension, independent small finger extension, and independent index finger extension. Notice that although the triceps muscle is innervated by the radial nerve, it is spared in this scenario because the innervation for the triceps is higher than where the radial nerve would be injured with this fracture. So the incidence of radial nerve palsy after a humeral shaft fracture in adults is around 12 to 14%, and the incidence in children is around 4%. The radial nerve, remember, is a branch of the posterior cord of the brachial plexus. It runs posteriorly in the arm and is very, very closely associated with the bone there. It basically goes in an area called the spiral groove, and that is a notch basically in the bone of the posterior humerus. So it is almost in direct contact with the bone there. Hence, due to the nerve being in close proximity to the humeral shaft, it is often injured with humeral shaft fractures. So the answer to the question is D, radial nerve. Well, thanks for watching, and we'll see you in the next one.